Hello, Diaz here, founder and owner of Greenwood Dental. Today I'm talking about the difference between the electric toothbrushes, Oral-B and Sonicare. This is a question that I'm constantly getting from you guys at the office. And I'm gonna give you my take from the technical point of view and from a clinical point of view and my observational data too. So Oral-B is, in my opinion, the best tool or the best electric toothbrush that mimics the motion and the mechanical performance that you get in a dental office for a couple of reasons. The first reason is the head of the toothbrush is round. Nothing in dentistry is rectangular, and nothing in dentistry that actually excavate decay, kicks off plaque, that doesn't spin. Okay, so we have a round head and also we have a spinning motion. So Oral-B as a toothbrush has really evolved to mimic and illustrate that motion for you to have at home and to achieve that, optimal cleanliness. So compared to Sonicare is, first of all, the head is rectangular and it does this. It does like the fluttering motion or the feathering motion. Nothing in dentistry, as far as a tool, an invasive tool that gets the job done, has that kind of motion. So that said, please check my video on brushing. I talked about the tools. I talked about the technique that you use. So Oral-B spins. Think about when you go to a car wash and you put your car through the mechanics, the big wheels, the spinning wheels, those are the ones that are actually kicking off all that dirt, all that salt, and making, soaping up and foaming the car clean. So that's almost the same motion or the same idea behind the Oral-B spinning action. When you spin something that's round, first of all, it's a round head because it's small. It can actually reach all the way back behind the molars and reach behind where the tongue is. And also you can angle it, invertly towards the upper molars. That's why the heads are, the smaller the head, the better. That's in my opinion. But also spins, that kicking motion will kick the plaque off, like I said in my other video. It will keep the plaque off too. And also, as a spinning motion, rotation motion, is like you're stimulating, you're massaging the gums, like you're massaging a knot out of your muscle. So that stimulation, that's feathering, is not massaging. Swooshing around is not massaging. It's actually the spinning rotational movement. You get a lot more stimulation for the blood flow, the regeneration of the blood flow to the area, stimulation, and that's why your gums stay tough. The gums are nice and blanched and pink. They're not screaming on us, bleeding, and sensitive when you get the cleaning. So that's why I'm in favor of the Oral-B. Now that said, I have patients, like I said in the brushing video, I have patients that brush with a manual toothbrush. They're immaculate. That's fine. But if you are asking me as a tool for somebody that's struggling to keep their mouth clean and keep their gums healthy, and you don't want to hear from us every time you come for the cleaning, you have a lot of buildup, your gums are really sensitive, the Oral-B is the right tool to start with. If you don't want to think about brushing, you want a tool that does the work for you, Oral-B is the tool. Now, that said, again, in my other video, refer to it, I have a lot of patients that have been using the Sonicare for years and years, and they do well. So it's not only the tool, it's your technique, okay? So I hope that helps and differentiate the difference between the two tools and what the tools do, and whether it's the right option for you or not. But of course, when you guys come, we can discuss it a little bit more, customize it on your signs and symptoms. And again, that's what makes us different from other practices. It's all about your experience and it's all about you. All right, we love you guys. Stay safe. I'm out of time again. And I catch you on the next video. DS out.